Hi, good morning. This is Chandravati Gurung, third year student from York University, and now I'm going to explain on the topic on palpate the posterior thorax. And today I'm not going to use the patient, so I have not demonstrated the procedure of permission, consent, and hand washing. So we palpate the posterior thorax for the equal chest expansion, tactile fremitus, and palpation of the entire thorax. We palpate the entire chest wall gently through the use of fingers to detect any abnormalities such as tenderness, to note the skin temperature and moisture, to detect any superficial lumps or masses, and to explore any lesions that are noted during inspection. For the chest expansion, we are going to use our warmed hands against the posterior lateral chest wall of the patient. Place our thumbs at the level of T9 and T10. Slightly move medially both thumbs to hold a pinch of skin in between the thumbs, and ask the patient to take a deep breath. Now our hands are going to serve as a mechanical amplifiers, and when the patient inhales deeply, both of our thumbs must move apart symmetrically, so not any lag in the expansion. Chest expansion is unequal with the marked atelectasis or pneumonia. Pain accompanies when there is pleural inflammation during breathings. So the next one is tactile fremitus. Tactile or vocal fremitus is a palpable vibration. Sounds are generated from the larynx and are transmitted through the patent bronchi and through the lungs parenchyma to the chest wall, where we feel them as the vibrations. So to palpate this vocal fremitus, we can use either the palmar base of our fingers or the ulnar edge of one of our hands and touch the patient's chest while the patient repeats the word blue moon or 99. These are resonant phrases that generates strong vibrations. So we start over the long apices and palpate from one side to another and note the symmetrical on the both side of the corresponding sides. Avoid palpating over the scapula because the bone dams sound transmission. The following factors affect the normal intensity of the tactile fremitus, such as fremitus is more prominent between the scapula and around the sternum because the major bronchi are closest to the chest wall, and it normally decreases when we progress down. Fremitus is more prominent over a thin chest wall rather than obese or a heavily muscular one. And third one, a loud low pitched voice can generate more vibrations than a soft high pitched tone. So we have to find out the abnormal fremitus. As we know that sound is conducted better through a uniformly dense structure than through a porous one. So in the conditions like compression or consolidation of the lung tissue, for example in lobar pneumonia, fremitus is increased vibration is found, but we have to note that it occurs when the bronchus must be patent and the consolidation should extend to the lung surface, and decrease from fremitus occurs when anything obstructs the transmission of the vibration, such as obstructed bronchus. And the other abnormal findings are bronchial fremitus. This is palpable or felt when inhaled air passes through the thick secretions in the larger bronchi, and it may decrease when coughing. And the pleural fremitus is palpable when the inflammation of the pleura is present. So the last one is crepitus, which is a coarse crackling sensation palpable over the skin surface, and it occurs in the subcutaneous emphysema when the air escapes from the lung and enters the subcutaneous tissue. Here ends my presentation. Thank you.